Okay, now we'll continue with bones of the lower extremity. So we start with the pelvic girdle. Consists of the hip, coxal, pelvic, or inanimate bones. You might also hear it as the os coxae. The hip articulates with each other anteriorly and with the sacrum posteriorly. The pelvis itself consists of the sacrum, coccyx, and pelvic girdle. So the entire pelvis contains the pelvic girdle, sacrum, and coccyx. Okay, so that's the pelvis. The pelvic girdle consists of the two hip bones itself. Okay, supports the trunk of the body on the lower limbs, provides attachments for lower limbs, and protects the organs within it, such as the urinary bladder and the large intestine. Oops. So here's the hip bones. Technically, your hip is right here. Okay, so here's the sacrum, the coccyx. Here's the pubic symphysis. Here's the obturator foramen. When you're looking at an x-ray, if these holes are not even, then you can see if one pelvis is rotated anteriorly, posteriorly. Here it can tell you that there's a shift. These two holes, if the pelvis is aligned, should be relatively the same size. Okay. So you can see here it's slightly smaller than this one. Then it could be that the left side of the pelvis is rotated posteriorly a little bit versus anteriorly. So, okay. Yeah, this is a patient that went, I forget, snowboarding or skateboarding. Either way, either one can do damage. So these are screws to hold everything in place while the patient tries to heal from this. Not fun. Now there is a difference between a male and female pelvis. Obviously the female pelvis is a little bit wider just for childbirth. This birth canal, definitely you don't want a child coming through there, unfortunately, because the sacrum is pointing this way, the baby would get stuck right here. For the females, this is wider, more oval shape, and then the sacrum is tilted posteriorly so that the baby can go through the birth canal. On some women, the sacrum can be anterior, so this is why they failure to progress and maybe they need a C-section, or this opening is too small and the baby fails to progress as well. So there are many reasons why women need to get a C-section, but that would be the call of the OB or the surgeon at the time. The pubic arch is also wider, okay, versus narrower. So anatomically, remember, if we were to find a skeleton in the woods, we could tell if it's male or female based on the pelvis, which is what they can use definitely. And the skull has some distinct features, but nothing as good as the pelvis. The pelvis can definitely tell us male versus female. Now the pelvic girdle, female hip bones are lighter, thinner, and have less evidence of muscular attachments. The female obturator foramen are triangular, whereas the males are oval. The female acetabular are smaller and the pubic arch is wider. The pelvic cavity, female pelvic cavity is wider in all diameters. The sacrum for females is wider, and the sacral curvature is bent more sharply posterior, so that makes room for the birthing process. And the coccyx, female coccyx, is more movable than it. So these are some good differences. I could easily ask you on a quiz. I could describe some characteristics and you could tell me if it's male or female. So I would look at this. So here are the three bones that make up the coxal bone. Again, the os coxae is a combination of the ilium, the ischium, and the pubis. These are some features. The iliac crest, which is up here. This is the anterior portion, so anterior superior iliac spine, anterior inferior iliac spine. Here's the acetabulum, where the head of the humerus will articulate. Okay. Here's the pubic crest, here's the pubis, and that's the obturator foramen. Again, oval in men and triangular in females. And here's the greater sciatic notch, where the sciatic nerve goes through. Each coxal bone is made up of, again, the ilium, the ischium, and the pubis. The ilium is the largest and uppermost portion of the hip. Features include the iliac crest. The ischium forms the L-shaped posterior portion. The pubis constitutes the anterior portion of each bone. Three bones are fused in the region of the acetabulum, the cup-like depression that articulates with the head of the femur. The lower extremity, just like the upper extremity, has 30 bones. So the femur, you have a tibia, you have a fibula, you have a patella, which is your kneecap, which obviously you don't have in your upper extremity, tarsals, metatarsals, and phalanges. So where the discrepancy is where you have 8 carpal bones in the hand, you only have 7 tarsal bones in the foot, and the patella makes up the 8th, right? So you still have 30-30. The femur, also called the thigh bone, extends from the hip to the knee. It's the longest bone in the body. The head fits into the acetabulum of the hip bone. Also articulates with the tibia at the medial and lateral condyles. Now remember, the femur does not articulate with the fibula, meaning it does not join. It articulates with the acetabulum, it articulates with the tibia, but not with the fibula, which is on the outside. The patella kneecap articulates with the femur at the distal anterior surface and is situated in the tendon that passes anteriorly over the knee, which is your patellar tendon. So here's the femur, here's the head, here's the neck, the trochanter, lesser trochanter. Remember, the humerus also had tuberosities, tubercles. So you want to get used to these names: trochanter versus tubercle versus tuberosity. Trochanters are large, tuberosities are medium, tubercles are smaller, so you can get used to the size. Okay. And then you have a condyle, which is larger, and the epicondyle, which is smaller. Okay, but remember, you have a medial epicondyle, which on your humerus, but you also have a medial epicondyle on the femur. So you want to always name the feature and the bone, so I know what bone you're talking about. Here's a fractured femur, spiral fracture. Tibia, also called the shin bone, weight-bearing, larger of the 2 leg bones, articulates with the femur at the medial and lateral condyles. Its anterior tibial tuberosity is the point of attachment for the patellar ligament. Sometimes boys grow too fast during puberty, and they might get a larger bump, and we call that Osgood-Schlatter's. You just grew too fast. Eventually, around 16 to 18, everything catches up, and that pain should subside. But if you have a son, or if you see a patient that has a relatively large bump, and they complain of pain, I mean, right now we just manage it when they're younger, limit the running, limit the jumping, until the tendons and everything catches up. Not much you can do. Don't need surgery. Just watch it. If the pain is too bad, then we got to limit their activity. Can't run, can't jump, so limit track and basketball and soccer if they need it. Other features include the medial malleolus, which is the inside of your ankle. The fibula is the smaller of the 2 bones, but it does not bear body weight. And it's not part of the knee joint, like I mentioned, so keep that in mind. And features include the head and the distal lateral malleolus. Oh yeah, look at that. America's game. Ooh, yikes. That looks very painful. There's the fibula right here and the tibia right here. So the tibia is the larger and the fibula is the smaller one. Fibula is lateral, tibia is medial. So that's why you get the lateral malleolus. So if you touch the outside of your ankle, that's the lateral malleolus, and the inside of your ankle is the medial malleolus. And there's that bump I was telling you about, the tibial tuberosity, that can get elongated because if you're growing too fast, you're pulling on this bone and the muscles are pulling. It can cause more bone to be deposited here, and we call that Osgood-Schlatter's. Oh yeah, I should have warned you about this. Yeah, look at that. That says tibia, and oh, yikes. You remember this one? Yeah, that says tibia sticking out of the skin. Yeah, sorry about that. I should have put a little disclaimer there. Yikes. Yeah, let's move on to that. Okay, there's the foot. The ankle is composed of 7 tarsal bones. Remember the 7 tarsal bones compared to the hand that has 8 carpals. So the extra patella is where you get the 8. Okay, so the talus articulates with the tibia and the fibula. The calcaneus is your heel, supports the body weight. So a lot of times people can get heel pain. The instep consists of 5 long metatarsal bones. So if you have 5 metacarpals, you have 5 metatarsals down there. And then toes, each consists of 3 phalanges, the proximal, middle, and distal, just like the hand. And the big toe, just like the thumb, only has the proximal and the distal. So here is the diagram. Here's the calcaneus, calcaneal tuberosity. Here's your arch, if you call this right here, the navicular. Sometimes if the navicular drops, you can get flat feet. Here's the medial cuneiform. Here's your metatarsals. Here's the phalanges. And there's the tibia and the fibula on the lateral side. So this is, you're looking at the instep right here, medial view. Yikes, soccer's dangerous. Soccer is dangerous. Yikes. Yeah, this is not pretty. Now, I don't know if you remember when at the time in ancient times they used to bind the feet. The smaller the feet, the pretty, or consider that beauty. But also the emperors bound their feet so they had to be weighted on hand and foot, right? So they had to be carried everywhere. So they just got heavier and heavier, and the more servants carry you from room to room, that showed real royalty, because you didn't have to do anything. But this looks nasty, right? Oh, the toes are kind of in there. Now, this can happen in Western cultures where if we're wearing high heels or shoes too much. Here's a good demonstration where you get bunions and the shoes are too tight, right? And then you can get that. It's very rare to see bunions in the Asian countries where they're barefoot or wearing flip-flops, but bunions and foot deformations are very common in the Western culture, shoe-wearing cultures. And here's the calcaneus, the tarsal, the lateral cuneiform, the intermediate and cuneiform. On the previous slide, I said wear your real shoe size, and the reason is about 10 years ago, women were removing the third metatarsal so they could fit into high heels. So they're actually removing this bone so that they would get a narrower foot. Unfortunately, you don't want to do that because obviously for many obvious reasons, but biomechanics, your gait is going to be altered, and then it can mess up with your knee, your hip, back, and you can't just put that bone back, right? So you want to be aware of the consequences that that can occur. All right.